Hello, good morning, good morning. Welcome back to the Precise IHCC conference. This is day 3. I'm Shiwi, I'm the Director of Corporate Services at Precise. Myself and my colleagues, together with IHCC colleagues, put together this conference. I hope you have found it illuminating and invigorating thus far. The 4th plenary for the conference will be delivered by Professor Vajira, Dissanayake. Professor Vajira has many appointments, including being the founder member and the current chair of the board of directors of the Global Genomic Medicine Collaborative. And this morning, he will be describing to us how the collaborative is drafting a plan to implement genomic medicine towards universal health coverage for all people. Professor Vajira, please.
Good morning, everyone. It's indeed a pleasure to be here to talk to you about implementing genomic medicine towards universal health coverage for all people. My talk, in a way, is the story of what goes on in the background of the Global Genomic Medicine Collaborative and how the leadership team is working towards enabling you to implement genomic medicine, take genomic medicine from the cohorts to the clinics. So it is a story, an interesting story that I would like to relate to you. And I hope that that will enable you to relate to the organization as well and become a part of this global journey that all of us have been embarking on or have been trotting for the past decade. You will realize why I said decade in a little while. First, let me begin with 2 definitions. We all know what genomic medicine is. But what is universal health coverage? Universal health coverage is a term that has been coined to mean that all people have access to full range of healthcare services they need, when and where they need them, without financial hardship. Now just reflect on it for a moment and reflect on what we heard during the past 2 days in this conference. Can there be universal health coverage without genomic medicine? The answer is no. A resounding no. A health system that has not implemented genomic medicine cannot claim to have universal health coverage for its citizens. That is a key message that we should all take to wherever we are working the health systems. The term universal health coverage gained prominence with the enunciation of the Sustainable Development Goals by the United Nations in 2015. And Goal 3 talks about good health and well-being and ensuring healthy lives and promoting well-being for all at all ages. Again, you can ask the question, does a health system that has not implemented genomic medicine able to deliver on the 2030 commitment for health of Sustainable Development Goals? The answer is a resounding no. In 2014, a group of us met in Washington at a meeting called the Global Leaders in Genomic Medicine, that was convened by the Institute of Medicine of the USA and the National Human Genome Research Institute. The lead was taken by none other than Jeff Ginsburg. And all of us are here today because of the leadership that Jeff took to convene this meeting, as well as then, going forward, establish the IHCC. And I would like to, in the 10th anniversary of this meeting, acknowledge Jeff's leadership role and request the audience to applaud him with a round of applause. Jeff. There, we all knew that we were not alone. All those who met there contributed to this paper, where we said that we were on the path for global implementation of genomic medicine, and we are not alone. And that was the key message from that. And that was reassuring for even people like me working in resource-constrained settings, such as Sri Lanka, because we, too, were motivated to embark on a journey that, in scale, may be smaller than what is there in the developed world, but in the way we think and we implement, we are alike. And that way, we are able to implement genomic medicine anywhere in the world if you just take leadership and champion the cause. What we did, the deliberations that we had in Washington led to the formation of the Global Genomic Medicine Collaborative in 2016. And thereafter, we have grown. Today, the collaborative has two consortia, the IHCC, which has brought us here, and the Global Genomic Medicine Consortium. We are a strong organization, always evolving and adapting and going forward with a purpose, the purpose of implementing genomic medicine. In 2018, we met in Cape Town, South Africa, where we deliberated on genomic medicine implementation in low-resource settings. To complement our deliberations, we articulated a Cape Town Declaration, which was titled Implementing Genomic Medicine Towards Universal Health Coverage in 2030. I'd like to take you through what we elaborated in that declaration. There, we recognized the role of genomic medicine in improving patient safety and outcomes through genome-informed prescribing of medications. We recognize the role of genomic medicine in improving clinical outcomes in individuals with conditions such as cancer and cardiovascular disorders. We also recognize the role of genomic medicine in improving patient quality of life and longevity through genome sequencing in neonates, children, and in adults in various clinical settings. We also recognize the role of genomic medicine in improving diagnosis of infectious disorders and identification of antimicrobial resistance. And finally, the overall benefit to society and family well-being. With this background, we called upon governments, intergovernmental agencies, international development partners, as well as the World Health Organization to recognize the importance of implementation of evidence-based genomic medicine as an integral part of healthcare, while addressing cross-cutting issues in different countries' context, the ethical, legal, social issues. We also called on them to establish workforce norms and human resources capacity development to enable the implementation of genomic medicine. We all recognize the importance of that. We also call on them to promote genomic medicine education at all levels of undergraduate, postgraduate, and continuing professional development of medical and other healthcare workers, as well as scientists and biomedical informaticians, and so on, to prepare the workforce for the future. I was really impressed by the fact that, I guess for the first time in one of our conferences, we had not just the medics and the scientists, but also other healthcare professionals presenting, making podium presentations at this conference. That shows that we have gone a long way. We've also wanted this organization to raise awareness and trust in genomic medicine among the general public, and to promote research and development for low-cost, highly effective genomic medicine technologies to accelerate its adoption in low middle-income countries, where the bulk of the world population is residing. And then to obtain deeper knowledge of underlying genetic variation in diverse populations worldwide, to enhance the use of genomic data for population-specific genome health programs. And we all know the importance of that from what we heard in this conference. And finally, we called on the World Health Organization to adopt a World Health Assembly resolution on genomic medicine to draw the attention of all those concerned so that action is taken to reduce the gap between the high and low income countries in implementing genomic medicine. We know when a World Health Assembly resolution is adopted, the entire world machinery starts moving in the World Health Organization, and in the absence of such a resolution, it is do as you please for the regions, and we see that then there is no global movement, but regional efforts, which generally don't scale up as a global effort. So you can see, ladies and gentlemen, the Cape Town Declaration articulated our vision for the future and also our call to action. And we used this as an advocacy document and went to the World Health Organization. We spoke with Dr. Soumya Swaminathan, who was the chief scientist, the first chief scientist of the World Health Organization. She came to 2 of our meetings, the 5th and the 6th meetings that we had. We were planning to have them centered around South America, but COVID had its say, and we had to have those meetings virtually. And the advocacy that we did with the chief scientist of the WHO was followed by meetings by myself and Jeff with Professor Harold Vermes, who was appointed the chair of the first ever Science Council of the WHO in the years 2021, 22. And those efforts led to us being able to make representations to the first ever consultation that the Science Council had, and they gave priority to implementation of genomic medicine. So the first ever roundtables that were there towards the last quarter of 2021 was a pivotal point where we could make our representations at that forum. The learning from our membership that informed the declaration, and we were able to take that to the Science Council. When we made those presentations, the message that we took to them was what it takes to implement genomic medicine in low middle income countries. And our objective was to present the human resources, technology, and educational needs, as well as the logistics and regulatory challenges, including barriers to collaboration that were faced by us. And we drew on the knowledge that we gained from what we call the Genomic Medicine Clinics for Rare Disorders flagship project of the G2MC. We had collaborating sites around the world, mainly from low middle income countries, but also others. So this was a global collaboration which informed our deliberations or our presentations to the Science Council. We highlighted some of these key issues, and I'd like to present them to you to acknowledge the fact that we as an organization are cognizant of the role that you are playing and the context in which you are playing those roles to implement genomic medicine. We realized that in most settings, the implementation is led by clinicians who have had training abroad, usually in the West. And it is true, I think, for all LMIC countries. As a result, the clinical capacity was strong. But we had a weakness when it came to genetic counseling, because in most parts of the world, genetic counseling is not recognized as a regulated medical profession. And that is a challenge. And I know, sitting here in Singapore and engaging my colleagues in East Asia, many of your countries, although you have a very strong education program, you lament the fact that genetic counseling is not an identified regulated profession. Scientific capacity was strong, again, because science teams were, again, led by strong scientists who have had exposure abroad and have come back. And there was also bioinformatics capacity to a lesser extent, but still, with training and support, you could go to higher levels. And of course, today, with the availability of internet access, availability of a lot of tools that you can freely access, we can take bioinformatics to a higher level. So this is where we still are, I would say, in terms of our human resources and our educational needs. Laboratory technology, on the other hand, was basic in most of these sites. Many sites had next-generation sequencing capabilities, but those sites were also turning to foreign service providers, and the reason for that will become obvious in the next slide. However, the bulk of local testing was done in the context of research rather than in clinical testing. The logistic challenges accounted for most of that. All equipment, consumables, and reagents had to come from elsewhere, cross-border, as it were. Establishing supply chains, therefore, was difficult. For most part, there were no local agents, or the principals were not willing to supply this champion who was championing in his country because it didn't make economic sense for the principals to support this jurisdiction. And as a result, the cost for testing was really high. In fact, in some centers, even DNA extraction cost $250 per extraction because of these challenges. So it was easy to outsource to testing laboratories abroad, and that was the route that a lot of people were taking. And COVID really brought in another level of disruption to this and made it more challenging. Of course, in the past years, couple of years, that has eased out. There were also the regulatory challenges. Regulatory approval was not available for equipment, consumables, and reagents. and regulators were unfamiliar with evaluating and granting approval for genomic technologies, consumables, and reagents. So those of you who are working in these settings would know the challenges that you have. And then when you went into the regulatory side further, the regulations were restrictive. When they were there, regulations were ambiguous. And of course, they were silent in most parts when it comes to things like sample and data sharing and so on. In some countries, you couldn't really get approval locally. You had to go to region or national levels, and if you are working in a large country, that would really be challenging. And then, of course, however, on the positive side, there was support at institutional level, and especially the ethics oversight, which is so very important as a first step for anyone embarking on genetic work in an institution, was fortunately available in all of these institutions that we were collaborating with across the world. That's the positive side to it. So looking at that background, we concluded that governments and regulators in LMICs do not recognize the implementation of genomic medicine as a priority, and therefore they do not take proactive measures to enable genomic medicine. That's an important thing for us, and we wanted to highlight that to the WHO because WHO has the mandate to influence governments and regulators. As I said, the sites that collaborate with us, all of you who are here today, are pioneering genomic medicine in your setting, and you are championing genomic medicine, and you are determined to implement genomic medicine come what may. And that is the strength that you have. And as an organization, G2MC is advocating with these global agencies so that that will one day enable you further. So our proposal to WHO was to support the establishment of pilot demonstration projects in LMICs, LMIC regions across the world, and gather lessons learned from these projects to inform longer-term scale-up. And I hope, even if the WHO doesn't do that, the examples that were presented today can be compiled and presented as global best practices that we could take to policymakers and decision makers across the globe. We also advocated for the establishment or the adoption of a World Health Assembly resolution with a global strategy and a plan of action to mobilize governments and health systems to take steps necessary to implement genomic medicine. And that is a mantra, as it were, that we are reciting over and over again, hoping that we would get the attention of the World Health Organization. But I think we need to work with governments, and I'm very heartened by the fact that this conference is supported by PRECISE, agency of the Singapore government, and I hope that we could have a conversation with PRECISE as well as other like-minded government agencies on championing a World Health Assembly resolution, because it has to be championed by a few governments and taken to the WHO. And that is something, a challenge that we as the Global Genomic Medicine Collaborative will take on behalf of our membership and all of you in this audience. These deliberations led to a WHO document on accelerating access to genomics for global health. This is, even in the absence of a World Health Assembly resolution, a powerful document. The document encapsulated all the presentations that we made. There are many in this audience who made presentations at that, including the leadership team of the Global Genomic Medicine Collaborative, plus I'm sure many others who are here who are not part of that team who made presentations. And the document articulates what has to be done in 4 themes. Recommendations for advancing use of genomics in all member states. The key word here is member states because it holds the governments to account, even though it is not a World Health Assembly resolution. And these are the 4 pillars or 4 themes in this document: promotion, implementation, collaboration, and ethical and legal and social issues. And I'd like to invite you to download the entire document from the WHO website and read it. Maybe you can even order a printed copy of that and then use that as an advocacy document at your institutions and with your governments and so on. In this background, last year, the Global Genomic Medicine Collaborative met in Geneva on the sidelines next to the World Health Organization to impress upon them that we hold them to account to implement what is there in that document, in the report. So the current current Chief Scientific Officer of the World Health Organization, Jeremy Farrar, was our keynote speaker. After the meeting, the leadership team of the Global Genomic Medicine Collaborative went to the World Health Organization and took part in a special meeting with the Technical Advisory Group on Genomics with the World Health Organization. And then we articulated to them what we want, what we'd like to see them do. And we hope that those ideas would be taken forward. And we are fortunate that some of our members are also part of the tag. Gabriela is there, Mark Abramovich, who is not here, is there, Nikki Tiffin is also there, and a few others. So we have, the eyes and ears of those in power, listening to us. This was the participation in our conference last year, and you can see global representation, many coming from LMIC countries, showing the willingness to implement genomic medicine. And we are very encouraged by that, and that is why, as an organization, we are representing them. The PRECISE conference in the last 2 days and today has taken this to a different level, a higher level. And we are encouraged by how cohorts have been taken to the clinic. And that also has enabled the leadership team of the Global Genomic Medicine Collaborative to reflect on how we plan to evolve. And when I looked at the themes of the talks and made this word cloud, you can see this word cloud was made from the titles of the talks that were presented in this conference. I took out the words genomics so that it'll not be the prominent word here. But you can see we are doing everything in different areas in healthcare, from screening to testing to treatment to whatever, and in different settings. And so we have genomic medicine being implemented across the board in healthcare systems, and we just need to have the emphasis on scaling it up. So 6 years after the declaration, we are in a good place. But the challenge for us is global implementation of genomic medicine by the year 2030. And all of us, have to go on a journey, on that journey together. And I'd like to invite all of you to join hands with the Global Genomic Medicine Collaborative. Go visit our website, subscribe to our mailing list, become members, and be a part of that journey and tell us how we can help you, because we will play that role and enable you wherever you are and whatever your setting is. Thank you very much.
Thank you very much, Professor Vajira, to Genomic Medicine and beyond.